but yeah, it is different. But I'm not nervous anymore because you're also friendly, and I want to thank you for that. Just the friendly faces, and
We thank you.
so I really feel at home here. So thank you for that. I don't see myself as an expert on autism in any way. The reason why I'm studying autism is because I am a teacher, and there seems to be so many students, more than in the last 5, 10, 15 years, with autism in the classrooms. And so I realized that I can't really help them if I don't really know what it's about and what their learning difficulties are. And now that I've started studying it, I'm almost halfway through the masters, but I'm not there yet, so I'm not standing here saying I know anything. I might just say things that you already know, which is not a bad thing either. It's good to have your memory refreshed. But when I started studying it, it was with the idea that I will now learn more about it. And the more you learn about it, the more you realize how little we really know. And even with autism, there are certain characteristics, and yes, there is a certain standard in which they're diagnosed, but every autistic child, or every child with autism is different.
Yes.
And they vary so much. So yeah, that's why we study, to know how little we really know. But I suppose we have to start somewhere. Maybe just before I get started, do you have any knowledge about autism? Yes.
My son is autistic.
My son has
yeah, I had to go through a vigorous process of when he was 3, he's 16 now.
Wow, you would probably be better standing here than I am.
Yeah, I had to go through, like, not how they do now, you go to doctors and they diagnose so easy.
Yes.
He had to do, like, proper therapies, you know, like learn how to, could he use his hands, like putting buttons and all that.
Wow.
It took over 6 months for the diagnostic process.
It is such a process,
and
isn't it?
He was, just no good. The older he's getting, the better he
I wanted to ask, may I ask, how is he doing now?
He has a lot of anger. He can't, and he realises his sense of smell and sight are really strong. He misreads a lot of people's. He doesn't like being with people because he can't interpret. You know, he'll think you're angry. Or you're
facial expressions, body language. Yep.
It's always been the same though from when he's there. That doesn't change.
What a challenge, and what a strong mother you are, I'm sure, because of this. Yeah. Anybody else? Yes.
My son has autism. He has Asperger's.
Okay.
Yeah, which is in the autism spectrum.
Yes.
But I was going to say with the misreading, Bodhi, my youngest, he had a whole heap of tests, and his senses are not on the same equilibrium. So his visual senses are very strong. His audible senses are practically non-existent. So he hates talking on the phone and things like that. So we've had to, like use Skype and things like that so he can...
That's very interesting. I know that the junior teachers in particular work a lot with visual cards and visual aids.
Yes.
And I'm sure that kind of thing would support your son in learning.
But it's just the system, like even the doctors, the system. He actually lives in Innisfail now because that's where he could get one-on-one, because that's where he needs to be. But it was really difficult for our marriage. So my husband and I separated because he was in denial, and I was trying to forge through with all this, and we got a diagnosis, my husband, and we're Christians too, so he sort of it attacked his whole faith. The whole thing. Yeah. So, so we're coming back from that at the moment. But it's just, my husband has actually got autistic tendencies as well. So he's very rigid, but it's exactly what Bodhi likes.
But that's interesting because in some of my lectures this has been mentioned, that when a child has been diagnosed with autism, oftentimes a mother or a father then start thinking, maybe I should also go for a diagnosis because I'm starting to recognize some of the symptoms. And it's never too, you're never too old to go for one of them, for a diagnosis.
Yeah.
My daughter is 19 years old and she was diagnosed with high functional autism
Last year?
Last year.
That is interesting. What is she doing now, if I may ask?
She's now getting help through disability services to help her improve a lot of the skills. I actually homeschooled her.
Wow.
Because the schools, particularly through the high school years, because the high school she attended or started to attend, the guidance officer rang me and said that she was too much of a fantasy. Well, I need to hire a dog.
A dog?
A dog to help ground up, because my daughter writes stories and draws lots of pictures. My daughter didn't talk until she was 6 years old. I moved myself and my 3 children to Queensland from New South Wales.
So there are dogs that are trained to help autistic students or children, but that is not on the evidence-based list yet.
She wasn't recognised as being autistic.
Okay.
She was just recognised as being a kid that lived in her own little world.
Which is autistic, isn't it?
Yeah.
Didn't talk till she was what, 6?
6.
6. Yeah.
6,
I moved myself and my 3 children interstate from New South Wales so that my daughter could see a speech therapist here in the school system, because down in New South Wales she was on the waiting list forever and would never be assessed.
It's so interesting. You can have a diagnosis of very low verbal skills, in other words, not being able to speak at 6, but still have a very high intelligence. So can you imagine the frustration in that child? And that's where I think a lot of the anger and the bad behavior comes from. Is from an understandable source and not just being rude or naughty. Wow, this is really interesting.
Yeah,
and
the acting out.
The acting out is
from the frustration.
That's right.
Yeah, because and I know with Bodhi, he's constantly looking because that's how he receives information, and he's quite a gentle soul too. But if he can't understand and he feels as if he's being victimised.
But won't all of us
Because
react
he
that
can't.
way?
Because he can't. But he can't verbalise. So it was causing him so much stress at one stage that he broke out in like this massive eczema all over him, and he had to go into hospital for 4 days on an antibiotic drip.
And that's another thing with autism. I always want to say students, because my target area would be the middle school, secondary school student. I'm not really targeting the early childhood. So when we start talking about early intervention and younger students, I don't know as much as I would know, let's say, 13 to 16, around about there. But what you find with students in all the age ranges and even adults is a high level of anxiety.
But it's like my son, he's 6'1", and he'll sit there and he'll just constantly bash himself in the head.
Frustration, anxiety.
He feels different. He doesn't. He wants to die. He doesn't feel normal. He hates himself. He just bash. He can't relate to anybody. He feels so from everybody. Nobody. He's just so isolated. He doesn't know anyone who feels the same way he does. He knows. He's at that point where he knows he's different. He just feels so different.
They know,
You just said he doesn't know anyone else that's like him. Do they have support groups for the kids where they can meet other? I don't have an autistic child. So I don't know.
Yeah. But it does sound like he needs to meet up with.
He's going to kill himself.
I know they have support groups with parents, but do they have them where the kids can meet other children like that?
Well, can you make a note for me on that?
There is actually it's a Christian organisation where this guy had autism himself. He wrote a book called Living with Autism, and he has actually set up camps, and they're actually finding that when the autistic children get together, they behave normally.
Really?
Yeah.
Yeah. You would do.
Because it's the socialisation aspect, and also too, it's really important to take that socialisation into consideration because it shortens their lifespan. Because it actually affects their heart.
Well, the thing is, they want to have friends, they want to socialise. It's not that they don't want to, and they have all those same emotions. It's just a different way of getting there, and it must be very frustrating for them if they can't get
growing
there.
up and actually being aware has come true. And I don't treat him. I treat him normally. I don't. His father, unfortunately, tends to. Oh, he was in denial all the way through. I was on my own. All the diagnostic process and our marriage broke up. The whole, like the same thing. But he's turned him. It's got a real fine line. He's got a lot of shit on his plate.
We will have to look into maybe later when we're done with this, maybe some support group or helping with the self-image. Because Temple Grandin, don't know if you've heard about her, she's a doctor in animal science, and she stands on stages and talks to people about her, she calls it a different way of thinking, which is exactly what it is, and she says she wouldn't be who she is if she didn't have that. And there was another clip that I saw on YouTube where 16-year-old said if he had the choice, if somebody could take this away from him, he wouldn't, because it made him who he is. So we just need to find out what are those little steps that they took to get to that positive self-image, which they so deserve because they're so special and they're so unique, and we all cannot be the same.
They're human like us.
Exactly.
You know?
And with the animal expert, Temple Grandin, she's done fantastic work with specifically cattle and how we treat cattle, and well, that's a whole different thing. But because of their different way of thinking, the whole society can benefit from that.
Yeah, exactly.
So they should not feel a low self-image at all.
My daughter actually writes an online blog about what it's like to be autistic living in this so-called normal world.
Yeah,
My daughter that get in contact with maybe my son.
She writes.
I think we'll need to have a bit of a conversation about this later, but let's just continue with this for now. But maybe, that was so interesting. I mean, we could talk about this all day, really.
I know.
That's right.
Yeah, really.
We need you here today, Sonja.
So here it says to see the world from a different perspective. And I think especially in the senior secondary school where I'm at, that's difficult because everybody wants to be the same. They want to wear the same clothes, they want to talk the same language, they want to look the same, they want to fit in, all the peer pressure is there. And that must be a very, very hard time for somebody that is so different. They don't always look different, but they think differently. All right, the definition. So there are many definitions out there. They seem to be a little vague and unclear, but the best one that I could find was a disorder in which there are markedly impaired social and communication skills and restricted interests and activities. So if a student has impaired social and communication skills but not restricted interests or restricted activities, that is not autism. It has to have a level of delayed development or impairment in both of those categories. Now, you've heard of the DSM? No?
No.
Okay, so we'll get to that. We'll get to that in a skill later. Yeah, okay. But that you'll see those two categories again there. Just something interesting, the name is derived from the Greek word autos, which means self. And that is maybe what makes them different at the very beginning stages, is they don't seem to need as much socialization. They do need it, but they don't show it. All right, and they seem to be able to keep themselves busy, and so that's where it comes from. It's not a new thing. It's just, I think we're becoming more and more aware of it. The word autism itself has been used in the past 100 years or so. But this ASD, which you're going to see quite a lot in this PowerPoint, is for autism spectrum disorder. And I just want to focus a bit on the spectrum. on the internet, if you type in, you know, Google search, love Google.
Yeah.
Yeah, it's so good. If you type in autism spectrum, you'll see a lot of images that look like umbrellas or a rainbow, and I think that's how we need to see the spectrum, right? Like a long line. And actually, we're all on the spectrum somewhere. Okay. But a student with ASD can be high on the spectrum, in the middle of the spectrum, can be severely limited, can be anywhere on this spectrum. So what is on the spectrum? Obviously the social and communication skills, restricted interests and activities, and there are a few more characteristics which we will see later. As you've already mentioned, from 2013 the DSM labels, not labels, I don't like labels, calls or names all these people on the spectrum. So you don't have Asperger's anymore. Asperger's is a high functioning autism spectrum disorder. And then there's on the lower scale as well, they don't have their names anymore, they're all on the ASD. Okay, so that's what I said. Previously a number of different terms were used, including Asperger's. Again, they are different, not any less. And that's actually Temple Grandin who said that. Just want to see if I missed. Just have a look at the puzzle pieces there on the turtle. We'll come back to that. Right, prevalence. An estimated 1 in 100 people have autism. I did read a research paper in the week that said 1 in 80. So it's certainly becoming more than less, yes. In Australia, that's 230,000. It affects 4 times more boys than girls.
Yeah.
Now there is a disorder, and I think it's called Rett syndrome, that affects girls only. But autism does affect more boys, but there are girls with autism.
And the reason for that,
They don't know.
Sorry?
They don't know.
They don't
They
know
don't
yet.
know yet. There's so
Because there
many
must
things
be a
that we don't-
reason.
There must be a reason,
Must
but
be
it's
a
not
reason.
known yet. No.
Is there a
Very-
certain
it could
place
be-
in the world where there's a more concentrated number of autism than...
Western.
Is
It
all
will be
Western?
in,
Cultures.
yes, but that could be just because the Western cultures are more
Advanced.
aware and diagnose these more information to diagnose this.
Right, yes.
Not necessarily that it's more prevalent, but yes, it does come from the Western
Actually,
society. Yep.
They got rid of the subinjection.
That one I just put in there because I love it. You know, the development of the brain, and it's all a maze, and so most of the brain development happens in a certain way, and then there are people whose brains develop differently. Okay. Not
how the
less,
neurons
just
are wired up.
differently. It's just the wiring up,
Yeah,
of the
connection.
neurons. I really believe that. All right, the word spectrum describes a range of difficulties that people with autism may experience, and then also the degree to which they may be affected. All right, so if you look at the spectrum, it goes that way, so that would be the range of difficulties, but then it goes that way too, because you can have higher functioning, medium, low functioning that needs people who need permanent help. Some people may be able to live relatively normal lives, while others may require continued specialist support. It can also not be cured. There is no cure for it. All right, so that's links to what I said at the beginning. The more we know, the more we realize, the little we know. We also don't know what causes it. For a while it's been believed that a refrigerator mom causes it. A mom that's cold towards the kid, the child. Not at all true. Not at all true.
No, I was very affectionate towards my child.
It has absolutely been proven over and over again that that is not true.
Yeah.
Another a myth, could we say, that was believed for quite a while is it's because of vaccines given to a baby or a child at a young age. That is not at all true. Not at all true. The only link that may be there is more or less the age that certain vaccines are given is more or less the same age that certain children are diagnosed with autism. In other words, that signs and because of different behavior is shown, the mom the mom or the dad says, okay, something is not right here, we go for a diagnosis, and then the diagnosis is there. But there is no link, there is no link, there is no link. There is no link.
Okay.
Got it? You're looking away.
No, I'm not. Yeah, no,
Okay.
they took away an injection. That luckily his younger brother, 3 years younger than him, didn't have to have. There was quite a few parents. There was a change in behaviour after that injection.
Yeah. Now, I am not refuting that.
One injection was removed.
What was it called?
From the PBS. It was he had 3 booster one. That was, I think it was the 6 month. The 4 month, the 6 months. There was a couple of injections were removed.
Okay, so what we've been told, there's been so much research done, and there is no link has been found.
I'm talking over a decade ago. We're talking a long time ago.
Yeah. But the fact that people think that there might be a link, we've been told, is because the diagnosis and the vaccine time is very similar.
Yeah, but that time period, they removed that vaccine pretty quick, smart, when there was a lot of parents.
And that makes you put a question mark there.
Oh yeah.
Yeah.
Not saying now, but there are other things why it is believed. I mean, I'm going to get shot in the foot.
No.
You ought not to. But dietary does have a lot.
Dietary,
The chemicals in the
environment,
it's not
food.
good.
Yes.
It's not just the chemicals either.
It's not.
But look, it is not good. It is just not good. Autism or not, it isn't. You're right. Yes.
We never had it at one point. Never got it.
It's our low-fat, high-grain diets are just destroying us on elements.
And all the processed foods. Well, that cannot be. We cannot argue against that. There is no official, properly researched link has been made. But I mean, we can use our common sense too, and look at these timelines and things. All right. Spectrum. I think I've explained that already. The line from mild to severe, and a person with autism can be anywhere on the spectrum. So we rather say a person with autism spectrum disorder. I would. At the university, we are told not to say. We are taught to put the person first. So we say a child with autism, the person with ASD, right?
Identify the
first,
person.
person first, yes.
You don't put the label first.
Exactly.
I know what you're saying.
Yeah, so that makes sense?
Yeah.
Well, we're taught the same.
You taught the same? So
Yeah,
you did
I've
the
got
same?
a child with achondroplasia.
There you go, yeah. So the person is first. Yeah, I think that's what I wanted to say about that. Oh, and also don't like it if they say a person suffers from autism. You have autism.
Yeah, I don't like the word
It's
suffer either.
from, no.
That's wrong.
Well, I think so too. So we don't say suffer from, and I don't myself, I don't really even like the word disorder. I would go for condition.
Yeah.
Is it
yeah.
a disorder really?
No,
Okay,
it's a condition.
It's a condition, yeah. So we might be, it just gives us a
What
different
about
way of looking
syndrome?
at it. Syndrome even better than disorder.
Yeah, because that just means ongoing.
And it is ongoing.
Yeah, and it's ongoing, yeah.
All right, I told you we were going to go back to the puzzle pieces. I put this in because it's really, really so interesting. The Autism Society of America uses a ribbon with puzzle pieces as a symbol, and that's because there's so much about ASD that is still a puzzle.
To distinguish them.
Yeah. Well, yes. On their webpage they use that as their symbol, and it's so true because there's so many pieces that we still don't have. And you can see it differently as well. You can see it as, because this person is developing differently, we have to put the pieces together in a different way. And that is a challenge for many mothers as well, I'm sure. So I just thought that that's very interesting. Oftentimes if you Google autism, you'll find the puzzle pieces. Okay, so the DSM is the Diagnostic and Statistic Manual on Mental Health Disorders. The latest one is the DSM-5, which came out in 2013. And that's where the change was made, that in order to receive a diagnosis of autism, you have the 2 categories. Before that, it was a triad. There were 3 categories.
Yeah.
But now it's 2. And it's just a way of grouping the characteristics or the symptoms together, really. A diagnosis for autism cannot be made biologically, so there's no blood test that can be done. It's looking at the developmental delays of the child, as well as looking at behavioural aspects.
It's a lifelong development.
It really is. And so what they do, as the lady previously said, it took 6 months to get the diagnosis. It does take time. You do need.
It's not biological. It's not genetic.
Oh, it can be.
It looks like it can be. If you look at families, it looks like it can be genetic, but there has no
They haven't found the link
official
yet.
link has been made yet.
Yeah.
What? No.
Yeah, because on my side of the family, and on my husband's side, there's children with Asperger's.
No, that comes up often.
Yeah, one boy and one girl.
See, it comes up often.
Yeah.
But it hasn't been linked yet. So you need a team of experts. You need your doctors. You need your team of experts. There needs to be
professionals.
Absolutely. You need your formal meetings with these experts. Also informal meetings. There will be lots of talking around a table. There will be questionnaires. There will be checklists. There will be lots of observing the child playing and people observing and checking lists. Early diagnosis is important. Can anybody think or tell me why you think it is? I saw your hand.
Lisa was diagnosed with slight, she's not bad autism, but slight, she's got that among other things. And she was diagnosed at 6 weeks old by the doctor. I don't know why. I think because I adopted the twins, obviously there is a history somewhere, or there's
possibly.
And they were wards of the state for the first 12 months. So
Were they in the welfare system for the first 12 months?
Pardon?
Were they in the welfare system for the first 12 months?
Well, they were with me, but they were still wards of the state. They were
not
still
officially,
officially wards of the state until the actual
Well,
adoption
that's
went
very
through.
young, but they
And
would have
they-
had some information, I'm sure. Yes.
So they're not born with them?
Look,
Well, see,
this
that's
is
an
very, very
interesting thing.
interesting. Some people show
That's right.
the signs at a very early age, but you get what is called regressive autism. And that is very interesting. That is where the child develops, reaches all the milestones that at the same time that, everybody, and then for some reason, the skills reduce. Or they
They
start
go back.
regression, yes.
Yeah.
They talk less.
That's
They
like my
socialise
son.
less. Was that what
His
happened?
milestones were normal till about 3. Then he got stuck in nappies.
Yeah.
He 4 still in nappies, 5 having problems, or went backwards. He
And it's
started
interesting
to
that you
have
mentioned
it
3
in
because I'm
his
sure I've read that it goes up to, it can happen any time from between 1 and 3,
Yeah.
where you
I knew something was wrong
Yeah.
before 3. The diagnosis was at 3.
so that it's very, very interesting. I don't know if it is dormant or latent or because it's certainly not seen before maybe 2 or 3. Other times for other children, it's seen from a very young age. Another question.
I'm coming in cold with this because I don't know anything about autism, and maybe you ladies can help me. When you said that they don't suffer from it, would the fact that they get agitated or aggressive show signs that they're struggling with it?
Yes, there's definitely a struggle at times, but I wouldn't like to say that it's a condition that they're going to suffer from their whole lives. It's just a condition they're going to have, and it's going to bring certain struggles.
Yeah.
You have to deal with me.
Yeah.
Okay. So you wouldn't call that
It
suffering
doesn't.
from it?
It doesn't mean that they
No.
wouldn't have
No.
suffering as you're thinking of suffering, but they don't actually suffer from the condition. It's not
I
something.
we all have certain challenges
Yeah.
in life, but we don't suffer.
More of a frustration.
It's like it's not a disease.
No.
It's not a disease. I suppose that's the definition. One's a disease. The other one is just a condition.
It's a condition.
It's how you're born.
It's a condition that
It's
you
a
So
have
more of
for
a
your life.
frustration
Yes.
they
And
experience
certainly
rather
there
than
will be
suffer.
frustrations. Yes, there will be.
Okay.
Heightened sensory, you know,
Yeah.
they,
Yeah.
Very heightened sensory.
Yeah. And that is definitely a problem. We'll get back. I want to mention that a bit later also. Yes.
When you were talking in relation to the regression
Yes.
side of things, growing up, I have an older brother that's actually now a male registered nurse, but growing up, Apparently, that's what I did. During my childhood, we all got separated, and I got placed into the care of strangers.
Yes.
And according to my brother, they actually got worried because they thought I bordered on it, because I regressed to the point where they had to actually reteach me how to speak.
Wow. Could that have been because of the trauma?
Could have been.
Yeah.
Possibly, could have been. I don't actually know.
Yeah. But it's truly interesting.
But
because with my son, we moved around. There was a lot of trauma in our family at that time, and one of the paediatricians that we took him to, she said that a lot of it had to do with the stress in the family and his development. So,
Wow. You see, that's where you need a team of experts,
yeah.
because that's where it becomes really, really complicated, isn't it?
Yeah, because if it's PTSD, well, they need to be treated for that, because otherwise it's just ongoing PTSD. It doesn't,
And talking
it just
about,
gets worse.
if it's this, then they have to be treated for that. We're talking about early diagnosis and why it's important, because we're talking about delayed development, right? So there's certain areas in which experts can come in and help with the development. And I think when a diagnosis is made, there can be so many things bothering the mother at that point, and we can't just start with all of it. So we have to prioritize and say, okay, what is troubling the family the most, or what is the most frustrating for the student right now? It might not be what the expert thinks it is, and that's why these informal meetings are so important, where you get around the table and the mother or the father say, well, this is our worry at the moment, maybe because of a relationship with a sibling, or something that the expert, might not think is the first thing that we need to look at. But then let's treat that first, and then look at the next, and then look at the next, and
explore the options.
Exactly, and that's why I think when it gets to senior secondary, where I work, a whole lot of the very pressing, very the crisis factors that can actually shake a family have probably already been addressed. So what I look at is how to take learning barriers away from them and open up the learning journey for them.
Yes.
So that would be maybe not as urgent at that young age.
Yeah.
Okay.
I think from experience, a lot of it's dealing with the parents as well.
Oh yes.
Because the parents go through a grieving process.
They do.
And
anger, despair, shock.
Yeah, exactly. Because and especially when my son was going to say before, with his hearing now, when he actually had the hearing test as a baby, and it came up perfectly.
Yeah.
So that little hearing test that they give them when they're born. So and now his audio is practically non-existent.
See regression.
Yeah.
I'm going to mention the hearing as well in a minute. So there are 5 main characteristics. You already know the social delays, difficulties with communicating.
Yeah.
There might be cognitive delays, certain areas of learning, not always. Special interests. Interesting when you're where I am at the senior secondary, and you have to teach a student who is not interested in anything else but heavy metal or zombies.
Oh, right. Okay.
Or a few years ago we had penguins.
Yeah.
And then,
Yeah, that's right. Yeah, it's so true.
And you have to incorporate the special interest into the learning process, or otherwise they're just not going to enter into that learning journey with you.
Yeah, exactly.
So for a teacher it's very, very challenging, and I can just imagine what it has to be for a mother. But, so that's the special interest, and if you can connect with a child in the area of special interest. I'm not interested in heavy metal at all, but I had to be. I had to go and read more about it, and I had to go and talk to him about it and start a conversation. Otherwise,
so you had to sort of bring yourself down to
you have to.
his level.
You have to.
Yeah.
Yeah.
I'm with you.
Yeah.
No, it's not down to that level. It's not